Here now, Administrator Seema Verma. She is a member of the White House Coronavirus Task Force. Administrator Verma, thank you. It's good to have you here tonight.
My pleasure.
How are we doing on these tests? So I remember last week, I believe, Alex Azar, the HHS secretary, said that there would be millions of them out there by the end of the week. Has that happened?
You know, our focus is on making sure that people that need tests can get tests. And so one of the things that's already available is that at every public health laboratory across the nation, these tests are available. What we're working on now is to increase the capacity in the private healthcare system, because most of us, when we go get tests, we don't go to a public health lab. You're used to going to your doctor's office, they order the tests, and that usually is handled through our private healthcare system. And so we've been working with the private system to essentially ramp up so we can make sure that those tests are available.
So is it true that there are millions of those? It's now almost the end of the week. So has that mark been met that we heard about from Secretary Azar? Because I was at a doctor for something else the other morning and asked, and they said, you know, we can't get them. We've been calling, we called the state, we called here, we can't get our hands on them. And then I heard it from another doctor earlier today with the same story with a patient that she wanted to test, and she tried to get a test for that patient and was unable to do so.
Well, today, one of the things that we did, Dr. Hahn and I hosted a call with over 1,600 representatives from hospitals to work with them around how they can do the testing inside their hospital laboratories. The other thing that we're focused on is preparing the entire healthcare system. Some of the conversations that we've been having with hospitals is making sure that they have the guidance that they need. So one of the things that we did just last week was give some more guidance around emergency rooms and what they need to do. So I think we're seeing emergency rooms across the nation setting up different screening sites so that they can screen people for the coronavirus on the front end. Those individuals don't have to come into the emergency room. The other piece that we're focusing on is infection control. We want to make sure that people don't pick up the coronavirus when they're in a healthcare facility. So we've asked for all of the healthcare institutions across America to double down on infection control practices.
Okay, but in terms of actual equipment, we heard Bernie Sanders today, for one, coming out and saying that there's a major shortage of ICU units. We've heard that there's a shortage of ventilators, even swabs and equipment for the actual tests. What's being done about that, and how concerned are you that when these numbers do start to rise, which Dr. Fauci has told us to expect, that there'll be enough ICU units, enough ventilators to help the people who do get sick in this country?
Well, that's why we have an emergency prepared system. You know, we're used to dealing with disasters. If we look at some of the disasters that have happened around hurricanes in Puerto Rico and Florida, there is a system in place to make sure that folks that are on the front lines have the equipment and the supplies that they need.
So are you saying that we do have enough?
One of the things that we're doing at CMS is to have rapid dialogue with healthcare providers. So we're meeting with providers almost on a daily basis to understand what challenges are they facing and what can we do at the government level to support them and help them. And that's why we've been putting out so much guidance. It's based on these dialogues that we've been having with the healthcare community about the needs that they have.
Yeah, I understand that.
The other thing that we've really focused on is telehealth and making sure that people understand, hey, before you go into your doctor's office, you can call your doctor on the phone and have a discussion with them. And they can tell you whether you need to come in or not. And that's really important because we don't want to have people have to travel unnecessarily if they're not feeling well.
No, absolutely.
And if they come into a healthcare facility, they could also be putting others at risk. And so we're encouraging people to call their doctor in advance.
Yes,
and we're making sure that providers can use telehealth and telemedicine to serve their patients.
We've made that point here quite a bit, and I think it's a very important point to make. But before I let you go, I want to ask you one more time. Are there going to be people in this country who don't get a ventilator if they need one? Are you concerned that the actual physical equipment that is needed to serve the people who will get sick is out there? Can you reassure everyone tonight that there is not a shortage of ventilators or ICU units?
And that's why the president has taken such bold and decisive action, right? We're not waiting for this to get worse. We're not waiting for this to be a crisis in our healthcare systems. And that's why the mitigation strategies that he announced last night, limiting travel from Europe, not allowing that. You know, we've given travel advisories on cruise ships. That's why we're taking all of this action, because we don't want to put stress on the healthcare system.
Okay, that's not a direct answer to the question, but it sounds like a hope that there won't be enough sick people and we won't run out of ventilators because we have mitigated, and we certainly hope that's the case. Administrator Verma, thank you.
Thank you.